Welcome back. Monty Cedar here. We're going to talk about a little bit of the healthcare reform and what it's kind of done to the industry. Over the last 3 to 6 months, we've noticed some things that the insurance companies are doing and changing, and we just want to kind of give you an update because some things are changing. Anyway, healthcare reform. Is it really healthcare reform? I call it healthcare tax and takeover because that's really, in my opinion, what it is. It's not about reform. It doesn't really do reform. It just taxes us, and as the government's takeover attempt. So when you look at healthcare, there's really kind of three areas that you can be in as far as the type of plans that you can purchase. The first one is what we call a cash indemnity, and there are several companies out there. The first one that is kind of the pioneer of this industry was Aflac. And we do have some Aflac products. There's many companies that have a bunch of different type plans like that, but they are what we call a cash indemnity, meaning they pay cash to you and then you pay the medical providers. And there's two types. There's a fee for event, which they pay you so much for a stitch, so much for the ambulance ride, so much for this, so much for that, and then there's lump sum. The fee for events can pay you out more in benefit than the lump sums, but the lump sums are, in my opinion, a little bit easier to understand. But you know, that's my opinion. You have to go through and read them and figure out what's good for you and compare the two and so on. We can help you do that. So anyway, there's in these plans you have so much for hospital, you get accidents, critical illness, and these plans are really not affected by the healthcare reform because they're not health insurance. They're indemnities. They're cash paid back to you. So this reform stuff is really not going to, I should say tax takeover, is not going to affect these type plans, and they're very predictable. They know statistically how many people are going to have accidents, how many people are going to go into the hospital from an accident, how much the cost is going to be. Very predictable, and you'll understand why in a little bit that the healthcare is unpredictable. So, no effect. Now, the next type plan, and if you review our videos, you're going to see we use some limited benefits and we married them with some of these cash indemnity plans. And there's still, we can still do that, but a few changes we've had to do. But within limited benefits, when we talk about limited benefits, the limit is either the payout per incident, it's a payout per year, it's a payout lifetime, or maybe they do reasonable and customary instead of what the negotiated rates are, like through a major medical. There's some little, I want to say, caps and tolerances. It's not like a major med. Mainly these plans strip out the pork. That's why we used them, just to get rid of the, you know, they were half the cost of these just because we took out immunizations and doctor visits and drug cards and so on. But within the limited benefits, there's two type plans you can get. You can get an accident only type plan, and those are guaranteed issue. Doesn't matter what your health is, and those plans are still available. They're for insurable and uninsurable people. And then you have limited benefit plans that were accident and health. And these are the plans that are going away because the insurance, you know, let me back up. These companies, most of the major players don't really offer many of these because they're not big money producers for them. The pork is where the profit is at. So these don't have the pork, so they really don't offer too many of these. These are offered by companies that you may not recognize their name. Not that they're a bad company. They have a lot of money, but they just offer niche type products. They're not in the mainstream like your major meds. So we'll address this. But then last but not least, we have our major meds. And like I said, pork is the profit. And what we're seeing with the insurance companies today, and maybe I'm wrong on this, if somebody can prove me or tell me differently, but this is what we're seeing. We're seeing more and more pork kind of being put into these plans, and the government, their mandate is to add more pork to these plans. So consequently, what's going to happen to the rates? They're going to go even higher because the insurance companies are not going to lose money on the deal. They've been at this too long, they're not going to lose money. We're also seeing that a lot of your major medical plans do not have really high deductibles. Going back to our limited benefit plans, we could get some fairly high deductibles, 15, 20, 25,000 and more deductibles. You don't see that in the major medical arena because then again, the profit is not there for the health insurance companies. And if you go watch our first video on the problem, you'll see the profits that these insurance companies are making and what they're paying their CEOs. So they're slimming their selections down. They're kind of getting rid of some of the stuff that maybe is not big producers for them, and they're just narrowing their scope. And you're seeing your rates going up 25, 30, 40, 50%. And in my opinion, if the takeover happens, if it really truly gets to law and it's enacted in 2014, your rates are, in my opinion, are probably going to be upwards of about 100% or more, and there's some reasons why. We talked in our first video on the problem. One of it is the baby boomers. It's just this group of people moving through time. We can't fix that, but there's some things we can fix. But the insurance companies, and this is some of the mandates that they're hit with. If we look at our insurance companies, what do they have to do? Well, 70% of their income is going out to pay claims and to put back to pay future claims. They invest it. And 30% goes to cost of business. Well, one of the mandates is the amount that they've got to pay out in claims goes to 80%, and the amount that they can use for cost of business is 20%. So, in order for them to get their cost of business up, what are they going to have to do? They raise the rates so they make more money. And where are they cutting? They're cutting insurance agents' commissions. That's one of them. Another thing they're doing, they're going to squeeze more of the doctors and providers, and you're going to see it. You're already seeing it with this takeover program that they're trying to do with Medicare. A lot of pharmacies and doctors are saying, we're not going to do Medicare anymore. We paid into it all these years, and they're not even going to accept people anymore because they don't even get reimbursed enough. So that's a big, big problem. We'll maybe do another video on that. But another reason the rates are going through the roof is one of the mandates is there's no limit on what they could pay out for a claim. Usually all your plans have some kind of a lifetime limit. Well, there's no limit in this. So how can you budget for something like that? The insurance companies are filling their coffers right now with cash. They want to have a lot of cash on hand because it's hard to budget for something you have no idea what the cost is going to be. Another thing they have to do because of the reform is accept everybody regardless of condition. How do you budget for that? I don't know how you budget for that. And they don't either. That's why they're filling the coffers, okay? And like I said before, they have to add more pork to the program. So you can see there is some very, very bad things coming if it really gets in play, I should say. Hopefully it can be unraveled. But going back to what we talked about before, limited benefits, why we use some of these plans. Remember again, most of the time you're paying premium, but if you have a health event, you're going to fall into one of four categories. It's going to be an accident, it's going to be a minor or major accident. A health event, it'll be a minor or major health event. So, if we had an accident-only plan, some of the accident plans between these two, we've got our accident piece pretty much covered. If it's a health event minor, where does that come from? That comes from the pool of money. If you go watch our second video talking about the solution, you buy catastrophic coverage, put money back into some investments, to some savings and so on, the rainy day fund. That's where that money comes from. Now, what if we have something that's a major? We're going to do another video that you have to watch because we're going to talk about, because of these going away, what is our solution if we don't want to go to this animal right here? We're going to show you some solutions on how you handle that, but you'll have to watch another video. I'm not sure what the title is going to be. It may be alternative ideas. You know, I'm not sure. Just watch and you'll see. And we talk about how to cover using these existing plans, even though some of them are going away right now. We'll see you on the next one.